Hey everybody, welcome back to my channel. So again, I'm sorry, I apologize that I'm filming on my vlogging camera. I'm gonna get rid of that chewing gum because I feel like I'm gonna make a lot of mouth sounds. So welcome back to my channel everybody. Originally I was gonna film a POTS slash EDS Q&A, but I've actually decided to do two separate videos. It is Dysautonomia Awareness Month, and around this time last year I actually filmed a POTS video. I'm actually going to be redoing that I'm going to be doing redoing that video kind of, but with Tom, to kind of show the difference between a normal person and someone with POTS. The second thing I just wanted to quickly mention is, although EDS isn't technically a form of dysautonomia, it is what causes it. It's basically one of the biggest causes. So, and again, I know EDS Awareness Month isn't till May, but I wanted to do this video because I don't have an EDS video up on my channel, and it's one of my biggest conditions that has caused a lot of my problems, and I get so many questions about it. So I thought I would basically do a video about it. So if you guys want to know what EDS is and how it affects me, then just please keep on watching. So EDS stands for Ehlers Danlos syndrome. There is many different types, but I'm just going to be talking about my type because that's the one that I know most about. It is type 3. It's just known as EDS hypermobility type, but it used to be type 3. It's basically Ehlers Danlos syndrome, but I'm going to be referring to it as EDS. So basically what it means is there is lack of or no collagen or collagen in your body, like in your skin. It's basically, collagen is a thing that holds everything together. So actually, where's this chewing gum? Hang on, I'm gonna give you a good reference here. So take this this hair bubble, for example. So this is nice and strong and stretchy, and this is what most people's collagen will be like in their body. But my collagen is like this piece of chewing gum. It is just, it's a bit slippery. It's just so stretchy, which means, so normal person is super strong, super like, you know, holds everything in place, and mine's just stretchy, flopping around like a sad worm, I don't know. You know, you've gotta sometimes laugh and be able to joke about your condition because there is funny things to it, although it does cause a lot of problems. So that's what collagen is basically. It holds all your muscles. I mean, it makes your ligaments nice and strong so it can hold your bones in place and stuff like that. So with someone with Ehlers Danlos, like myself, that we have lack of or very minimal collagen, which means our bones dislocate easily. It affects literally everything, like your organs, your bones, your joints, your blood, your skin, for example. Like, my skin is super stretchy. Like, look at this right now. Like, people think I'm joking, like, just for the thumbnail, guys. Like, I am not, like, this is not edited. Like, my skin generally stretches like this, like thing, like just like stuff like that, like really stretchy skin, guys. Like, I mean, I know my skin might not be as stretchy as like other people's, but it's still like really stretchy for me. How far? Like, so stretchy skin means we can move our joints and stuff in weird ways. For example, I can lick my elbow. And I have like a really short tongue, by the way. Like, I can do cool things like this, guys, which basically my shoulder is currently dislocated. I know my neck looks like it's in a weird position, but I don't want to show you guys too much because it is really bad for people with Ehlers Danlos. Like, I know it's like a party trick, but it is bad for them to move joints in weird ways that they shouldn't do. But for example, like a normal person's fingers, for example, will probably bend about there, but my fingers can just keep going back and back and back. Same with like my wrists and stuff like that, guys. Like, they're just like, look at my fingers right now. Like, just look at that. So it doesn't just cause dislocations and stuff like that, because obviously your joints are so loose. It means things dislocate super easily, which means you have to end up wearing a lot of braces. So I own braces for my knees, for my hips, for my wrists. For pretty much every joint I own some sort of brace for, or K2 tape, ACE wrap or ACE bandages, like stuff like that. I do wear braces, but not all the time, depending on how bad the pain is, stuff like that. I've just got a couple to show you now because There is a lot upstairs, but I don't really want to be running up and downstairs bringing them all down, so I'll just show you the couple that I've got here with me now. But in the future, like I said guys, if you guys want a full detailed video on like braces that I use, brands, stuff like that, then let me know and I can do like a full-on one. So the ones that, a couple that I've got here right now are like thumb/wrist ones, and two of them, so they're mainly for your thumbs, like these parts here. There's a spirit. So those are those braces. I have wrist ones identical, but they come further down. I got this big mammoth. This is a leg/knee immobilizer, and that basically holds your knee in place. I have loads of these guys, like loads. And it has like a special like rods up the side and down the back to keep everything in place, so dislocations and other injuries like that. And then I'm sure you guys have seen these before, a big old boot, again for ankle dislocations, tendonitis, anything similar that you need a boot for, stuff like that. So they're just a couple of my braces. Like I said, I have a lot more. I have like sleeves and stuff for elbows and knees, and I have lace up ankle braces which are really good. But yeah, so that's it for like the braces. How often do I dislocate my joints though? I would say I dislocate at least probably at least 5 or more joints throughout, like in a day, depending on the day. Sometimes it can be more. My joints that are more prone to dislocating are my shoulders, my fingers, my wrists, what else? My knees are a big one. Ankles aren't too bad. My ankles and hips aren't too bad. They mostly sublux, and sublux just basically means like partial dislocation, it doesn't fully come out of the socket. But I don't want you guys to freak out, and I don't want you to go, oh, my skin can like stretch crazily and do weird things. Like, that does not mean you have EDS, I promise you now. And I also promise you that there are other people with EDS may not be able to do certain things that I can do, and vice versa. They may be able to do, I mean, they might stretch more than me, but it doesn't mean that, you know, we don't have EDS just because they can do stuff a little bit different. Now, as far as a diagnosis, usually it does take a long time to get diagnosed, partially because one, it is genetic, which means your parents who you've got it from, you might not necessarily show much symptoms compared to you. And two, because symptoms don't usually show until later on in your life. Like, I didn't start getting symptoms till I was like 15, 16. So it's hard to kind of diagnose those things until you basically show symptoms. I also want to talk about the fact that EDS is not just EDS. Usually, if you have Ehlers Danlos syndrome, you will have some sort of a form of dysautonomia, and it is just Dysautonomia Awareness Month. Now, dysautonomia is basically where your autonomic nervous system doesn't function properly, and I'm not going to go too much into this because I'm going to make a separate video completely where I basically talk about that. But basically, I have postural orthostatic tachycardia syndrome, which I have basically coincides with Ehlers Danlos. So basically what it means is EDS has caused me to have POTS, which is postural orthostatic tachycardia syndrome, and that affects my heart. So as I was saying before, EDS affects everything, like your organs, and it's also affected my stomach. It makes all my insides very stretchy, very loose, which means like IVs and all my, so when I get an IV, like a drip in the hospital, they don't usually last very long because my veins are just super stretchy, super loose, and they just do not hold the cannulas. So that's another downside. And also, like I said, it's affected my stomach. It's essentially paralyzed my stomach, which is why I have a tube. This is a feeding tube, specifically an NJ. So I could basically get fed through this tube pretty much 24/7. Well, I say 24/7, but every time I need to eat or drink anything, I usually get it through my tube, including medications and stuff like that. As far as treatments, there is no cure or anything like that, but there are treatments. So wearing braces to help stabilize joints, physiotherapy is a big part of EDS to try and strengthen your joints as much as possible. And then also another thing is try not to bend them, even though I know like it's fun party tricks to bend your joints in funny ways and like, oh, look what I can do and stuff like that. Like, just try not to, because as much as I want to show you in this video, guys, it is dangerous. And because I've been having such a bad time with my joints recently, I don't really want to show you too much. But I can show you my fingers because obviously they bend really far and they're not really a problem area for me. Although they dislocate, I don't get as much pain. But my knees and my hips, my shoulders and stuff like that, I just don't want to try to move them as too much, guys, just because it is dangerous. I am wearing my Ehlers Danlos awareness shirt, by the way, guys. I don't really think there's anything else that I haven't said. I think that's pretty much it, guys. I will try and do a more in-depth video. Like, if you guys have more questions, just comment them down below and I'll try and answer them, because I know everybody's different and I know some of you might have quite more questions that I didn't answer, or maybe you want me to go more in depth. So let me know. If there's too many questions, I might just do a second video, like a part 2, where I like do like a question part of the video. If not, I'll just try and answer them in the comments down below. But yeah, that's pretty much it, guys. I hope this kind of give you more of an insight to what EDS is. I will try and pop up a few pictures of cool things that I can do with my body that I've taken at a previous time, just so it doesn't cause any problems for me now. But yeah, I really hope this was more of an informational video for you. I am trying to do more videos like this on my channel because these are the videos that you guys seem to like, and they're also the videos that obviously, like even the videos that are non-medical related, like the questions that I'm getting in the comments are more about medical stuff. So I hope that this does answer some of your questions. But yeah, I really hope you enjoyed this video, guys. Thank you so much for watching. Please subscribe to my channel if you're not already, and give it a big thumbs up if you enjoyed it. And please don't be scared to ask any questions down below. I will try and answer as much as I can. I guess I'll see you guys in my next video. Bye.